Can stroke cause visual hallucinations? Have you ever wondered if a stroke can lead to visual hallucinations? The answer is yes, and it's a fascinating topic. Visual hallucinations can occur in a notable number of stroke patients, especially if the stroke affects areas of the brain that process vision, like the occipital cortex. Studies suggest that around 16 to 40% of stroke survivors may experience these hallucinations during the acute or post-stroke phases. These visual hallucinations can be quite complex. Patients might see formed images, such as people, animals, or even geometric shapes. Interestingly, these hallucinations are often self-limited, meaning they may resolve on their own over time without needing specific treatment. So, what causes these hallucinations? The underlying mechanisms involve disruptions in normal visual processing due to brain lesions. There are two main theories that explain these occurrences. The first is called the releases theory. This theory suggests that damage to the brain can lead to abnormal signals being sent to the visual cortex, which can result in hallucinations. The second is known as the deprivation theory. This theory posits that when sensory input is reduced, the brain may generate spontaneous images, similar to what some people experience with phantom limb phenomena. A well-known example of this is Charles Bonnet Syndrome. This condition can occur after a stroke that affects the visual system, where patients with visual field loss experience vivid visual hallucinations, but still understand that these images are not real. There are specific types of visual hallucinations linked to strokes. For instance, peduncular hallucinosis is associated with strokes in the brainstem or cerebellar peduncles, leading to vivid and colorful visions. Another rare phenomenon is reversal of vision metamorphopsia, where the visual field may appear rotated or upside down, sometimes accompanied by hallucinations. Certain risk factors can increase the likelihood of experiencing visual hallucinations after a stroke. These include lesions in the occipital cortex and disturbances in sleep patterns. Importantly, these hallucinations are not necessarily linked to cognitive impairment or a psychiatric history. They often improve as the brain recovers. From a rehabilitation and long-term management perspective, recognizing visual hallucinations as a potential consequence of a stroke is crucial. This awareness helps in providing appropriate counseling and care for patients. Since these hallucinations can be distressing, reassurance and monitoring are essential. In some cases, a referral to neuro-ophthalmology or neurology specialists may be necessary. It's also important to note that hallucinations following a stroke are distinct from psychiatric disorders and usually do not requiring antipsychotic medications unless accompanied by other symptoms. In summary, visual hallucinations can indeed result from stroke-related damage to areas of the brain responsible for vision. They are relatively common, often transient, and arise from complex mechanisms involving disrupted visual processing. Understanding this phenomenon is key to providing proper support and management for stroke survivors experiencing these symptoms. Always consult healthcare professionals for personalized advice and treatment options.